Hello everyone. It's been 25 days since my surgery, and I figured I would give people an update. Um, so I'm still pretty swollen, and I have a lot of numbness. So it's basically from like this side of my nose to like kind of underneath my eye, which is really weird to have a numb eyeball. And then down kind of, and then like to the corner of my mouth to where I don't really feel like this portion of my face. And then like also kind of like my whole bottom lip, and from like the corners down to like my chin I can't really feel, which is strange, and I don't like touching it because for some reason I feel like I'm gonna hurt myself. um I'm not in a ton of pain anymore, except for like in my particular procedure, because of the cleft lip and palate, they had to take some of my hip bone and fill in right here, which is why I think I still have a lot of swelling right here. Um, and I think that it's not as much over here because I didn't have the bone graft, so this is like more normal. I do feel a little bit of swelling still, like right in here, but I have feeling like in this part of my lip, so that's nice. And it's very, I've stained a lot of shirts because I can't feel my bottom lip when I try to eat. Eating has not been easy. I'm not on a liquid diet anymore, but I still drink like a lot of chicken broths just because that's easy, and I have like these squeezy condiment bottles that really help. Um, my stitches are actually starting to fall out. So like this one got caught on my jacket and came out this morning, but I still have two over here. I don't know if you can really see those. And then I lost a couple up here, but I still have all the ones like down here, and then there's like some like way back here. Um, I'm not really able to open my mouth very wide yet, which is a bummer because that makes it really hard to eat like with regular silverware. So I have to use like kid silverware, which is kind of strange. And plus, like, right now, eating is kind of a hassle because after every time you eat, you have to do mouthwash. And then I brush my teeth, and then I actually have my first sinus infection that I've ever had, which is kind of interesting. And so I'm having to flush with salt water. I do that about 5 times a day, and it's a pretty uncomfortable and really gross. And then, because of the bone graft for my hip, I also, up until pretty recently, I was walking around everywhere with a cane. And that was, I don't know, it's not my first bone graft for my hip. I had my other hip done when I was 12 to try to fill stuff in because of the cleft lip, so this is actually a second time. So I kind of knew what to expect, and we kind of preemptively already had a cane for me. But if you are also having to have like the bone graft from your hip done, definitely go out and buy a cane because it helps a lot. And like putting any weight on your hip is going to be very uncomfortable for about the first 3 weeks. And let's see what else. Oh, my bite looks pretty great. My teeth definitely, like my front teeth, touch my brackets on the bottom, but I'm not allowed to go to see my orthodontist yet because they have to wait for this bone graft to settle before they can do anything else to me. And the fact that I can't open my mouth very much right now, they wouldn't be able to like put a helio on my teeth to make sure that like I have space in the front to where the braces aren't touching my teeth. But that's, I think, pretty common when you have such an extensive surgery with, you know, the orthodontic plus the bone graft. I do only have about 4 months after the surgery, they told me I would get my braces off, so I'm pretty excited about that. And I'm really hoping that that's kind of the timeline they stick with. And yeah, so that is up to day 25. I am talking much better now. The first about week, I was pretty, you couldn't understand what I was saying. I thankfully wasn't elastic or wired shut, but it was just like the physical movement of my mouth was really complicated. I had so much swelling, and just having my teeth in a different position was very strange, because I had a really deep underbite, and having my front teeth in the front now is like very foreign and weird, and I'm still getting used to it. But I am definitely excited to have gotten it done and be on the road to recovery, and just a couple more short months and my braces are off. I was actually supposed to have my surgery in June, but in March they shut down all elective surgeries, and so once that was opened up again, I actually ended up having my surgery in October, because my surgeon had to get caught up with all of his other patients that were kind of in line ahead of me, and then it was finally my turn. And so definitely keep that in mind if the pandemic is still ongoing while you're watching this, that if we do get locked down again, or if they change the rules at your hospital or your state where elective surgeries aren't really happening, you might have a delay in your services, which is a little daunting. I will definitely admit that I was a little frustrated, because there's a lot of anxiety and there's a lot of stress associated, and having that pushed out farther, it definitely didn't help. It kind of stressed me out even more. And then also, I would suggest, if you are feeling anxiety, to definitely let your doctors know. I was a little worried about being able to get a restful night's sleep the night before the surgery, so I actually asked my surgeon for something to kind of calm my nerves, and it was really big help. And I have an amazing surgical team, orthodontist team, and dentist, and so I'm really thankful for all of the support and how well my team in particular works together. So if any of you are watching, thank you. I really appreciate all of the hard work that everybody has put in, especially during a pandemic. I definitely feel like the surgery was worth it, even though my recovery is a little longer than most, because of the extent that they had to go to do more corrective on my cleft lip and palate, in addition to moving the jaws and with the bone graft. If you are in the process of like getting your braces, or you're gonna have the surgery, or you've had the surgery and you're in recovery, like, it does get better. You will be able to talk at some point. You will be able to eat at some point. It does seem like it's forever taking, and you will definitely be hungry. And I suggest not watching a lot of TV, because I didn't realize it before, but there are a lot of really good looking food commercials on, particularly, I don't know, there are just so many good ones, and it just made me hungry every time I'd see one. So maybe try to watch Netflix and Hulu, and not so much cable. Every other commercial is a food commercial, and it's kind of like torture. But anyways, if you have any questions, please feel free to ask, and I'll do my best to reply. So good luck if this is in your future, and I hope you're having a good recovery if you've already had it done. So